Hello, everyone. Today we're looking at the cervix. It's going to be a fairly short video and straight to the point, as it's a very simple part of the body to understand. So what we have is ecto and endocervix. We have two fragments here. This one doesn't show the endocervix very well, but we'll use this fragment here that has the endocervix. So if you remember, the ectocervix is lined by non-keratinized stratified squamous epithelium, which you can see here. And you can see that the stratified squamous epithelium is placed on a basement membrane, and it shows this normal maturation from basal cells to apical cells. And if you notice, the basal cells, they're a little bit more darker stained and smaller. And as they progress to the surface, they begin to become enlarged and more glycogenated. So you can see here the clear cytoplasm is actually glycogen rich. And if you stain this with a pus, you will see light up. Deep to that, we have the cervical stroma in the ectocervix, which is very, very vascular. You can see multiple blood vessels. And here, what we have here is the cystically dilated endocervical glands. So the way you see them adjacent to the ectocervix is just the way the specimen has been cut. But as you can see, they are also close to the endocervix. And if you remember, the endocervix is lined by simple columnar epithelium, which is what we have here. And sometimes it does secrete mucin. You can see there are sort of mucinous cells here. And it helps. Also, the endocervical glands are lined by simple columnar epithelium, which also secrete mucin, which helps lubricate the endocervix, which is what I was trying to get at with these cells here. Now, if you remember, there is a squamocolumnar junction, which occurs in the cervix and tends to vary with age. And it may vary between teenage and menopause. So you can see here, there is simple columnar epithelium, and then it goes here and then changes into a stratified squamous epithelium. And at this portion here, the squamocolumnar junction, you may find in some specimens an immature squamous metaplasia, which is within normal limits. It's a normal variant. So you can see here, there's columnar epithelium, and then the squamous cells sit on top. This is just a variant of squamous metaplasia, which is normal. And then the ectocervix is actually, or can I say the cervix is actually prone to viral cytopathic effect, which may cause an HPV-dependent malignancy or carcinoma in situ. So when we say there's a carcinoma in situ, you see this normal progression in the epithelial cells, the normal maturation. It's distorted. So there's what we call scene 1, 2, and 3, or low grade squamous intraepithelial lesion to a high grade squamous intraepithelial lesion. So in low grade, which corresponds to as scene 1 and 2, you can see almost partial thickness, loss of normal maturation. And in a scene 3 or HCL, you find full thickness, loss of maturation. And when it breaks through the basement membrane, remember in cancer cells, they may sometimes secrete your metalloproteinases, your MMP2/9, and may break through the basement membrane and seed here and begin to infiltrate, then later metastasize. But that's how it occurs in HPV-dependent lesions. And if you remember, the most high-risk lesions that cause Your seeing lesions are type 16 and 18, sometimes type 33, and other high risk HPV lesions. And then your low risk may cause your condyloma acuminatum. So that's just about the cervix. It's fairly simple, nothing complex about the cervix in terms of its normal histology. Thank you very much.